All right, we will go ahead and get started. Thank you all for being here for COVID-19 media availability. We're going to be talking about RSV today as we're seeing some rising cases in our area. So on the call today will be District Health Officer Kevin Dick to start us off. We'll then go to Dr. Rika Danko, MD, who is the officer at St. Mary's Regional Medical Center. Also, as you know, a member of the District Board of Health. She's also board certified in both internal medicine and addiction medicine. We'll also have Dr. Nancy Dow, Division Director here at the Health District for Epidemiology, available for questions at the end. So with that, we'll go right to it. Kevin Dick, officer, if you are ready, please.
Yeah, thank you, Scott, and thank you all for being here today. We have some increases in respiratory infections in Washoe County that people need to be aware of, and particularly in regard to COVID-19 and RSV. For our COVID-19 situation, our numbers for our COVID-19 cases that are reported to us are steady, but we anticipate more cases in the coming weeks. Our 7-day moving average for new cases per day sits at 32.9. And our COVID hospitalizations have increased slightly in the last 14 days. We're at 27 that are reported by the Nevada Hospital Association. However, our wastewater data is telling a different story. UNR is reporting significant increases in COVID-19 concentrations from local wastewater samples. And we went from very few detections in wastewater in mid-October, and we have now seen levels of COVID-19 in our wastewater that were last seen when we had the Omicron surge that occurred last summer in the July timeframe. So based on the data and previous trends from the fall of 2020 and 2021, we anticipate that we will see an increase in new cases in the coming weeks. As you know, more people are using at-home COVID-19 tests, and those are not counted in our cases that are reported on our dashboard. So it's important for us to recognize that increase that's happening in the wastewater samples as giving us a good indicator that we're seeing more infections occurring in our community, and we expect to see some increase in the COVID-19 cases. The UNR wastewater data indicates that 98.8% of the positive COVID-19 samples are the BA.5 Omicron variant, and the new bivalent COVID-19 booster is expected to be highly effective against the BA.5 variant. So if you're on the fence about getting a booster, I can't overstate the importance of getting an appointment scheduled as soon as possible. And there are appointments available at covid19washoe.com or going to vaccines.gov, or most of the pharmacies in our area are providing that bivalent booster. It's easy, it's convenient, it will provide you with good protection needed for the winter months. And so I think it's really important for people to get both their flu shot and their bivalent booster. We've got Thanksgiving coming up and the holiday season, so good to protect yourself and others. As far as RSV, our numbers are increasing dramatically. In the last 3 weeks, cases have doubled each week. We had 54 cases reported last week and have had 107 cases total reported in the last 3 weeks. In 2021, RSV cases were exceptionally high for the year, but compared to the same time last season, we're seeing higher RSV numbers being reported now in Washoe County, and we have had RSV outbreaks occur in child care facilities. RSV can cause serious issues for children and the elderly, and I'm very pleased that we have Dr. Danko, for our physician on the Board of Health, here to give us some more information on that. So I'll turn it over to Dr. Danko.
Hi there, can you hear me okay?
Yes.
Wonderful. Well, thank you so much for having me today, and I feel so honored to be part of the District Board of Health, and also I feel very honored to now have the opportunity to be the Chief Medical Officer for St. Mary's Regional Medical Center. So thank you again for this opportunity to be here and to speak with you today a little bit to help the community to understand a little bit more about RSV. So RSV stands for respiratory syncytial virus. It is a respiratory virus that infects and affects both the upper respiratory tract and the lower respiratory tract. In fact, we designate the respiratory tract by the upper portion, which includes sort of the nose, the mouth, the upper part of the breathing tubes, and then the lower tract being the trachea or the middle breathing tube, and the remaining breathing tubes that take the air down into the lung tissues. And we often think of RSV as an infection only of children, but in fact, RSV does infect adults and can certainly affect elderly and those who have immunocompromise, or those adults and those people in our community who have underlying heart and lung conditions. In fact, in those individuals, RSV can cause more severe infection and more severe long-term complications as well, such as difficulties with breathing and a decrease in the overall functionality of the lungs and the respiratory tract. So I would like to talk a little bit basic about RSV, and then if anybody has additional clinical questions, I will certainly try to address them and give some more answers. RSV in general spreads very similarly to our other upper respiratory infections. In fact, it spreads through what we call mucous membranes, meaning the nose, the mouth, the eyes. So we have droplets that come out, for example, when we're coughing or sneezing. And if those droplets are able to somehow get into the mucous membranes of another individual, then there's a likelihood that that person will become infected. The way to prevent RSV infection is really through those things that we've talked about through the COVID-19 pandemic. The factors such as hand washing, washing the common touch or cleaning the common touch surfaces, such as handles, doorknobs, fridge handles, faucet, sink handles, toilet handles, things like that, that we can really clean off because that virus can live on those surfaces, oftentimes for hours at a time. So contact with that surface and then a subsequent contact with the mucous membranes can lead to infection. In fact, what I've read is that during the COVID-19 pandemic, our mitigation measures such as distancing, mask wearing, hand hygiene, washing those common touch surfaces really led to a decrease in all respiratory infections, including RSV. So we know that those mitigation measures do help to prevent this infection. We are starting to see a rise in RSV cases and hospitalizations. And we'd also like to let you know in the community that if you have concerns, if you are worried whether your loved one has RSV, please seek out. We are here to address those concerns, do those medical evaluations, and provide additional information one-on-one as well anytime. With respect to what type of symptoms to look for with RSV, we really talk about the upper and the lower respiratory tracts. And with those tracts, we can see things like runny nose, watery eyes, sneezing, sniffling, coughing, and particularly sometimes we see breathing problems. And how can we identify breathing problems? The easiest way to do that would be to think about your normal breathing pattern or your child or loved one's normal breathing pattern and take an image of what that normal breathing pattern looks like. If something seems off with that breathing pattern, for example, it's faster or it feels labored or more difficult for that individual, or it seems like that individual is having a hard time catching his or her breath, then those are causes to immediately seek medical attention. With things like RSV and other respiratory infections, those breathing problems can get worse over time. In fact, in RSV, sometimes we can have, in children particularly, a condition called apnea, where we cease or stop breathing. And that is a life-threatening condition that can happen. So for sure, if you're noticing breathing patterns that are in any way seeming to be abnormal or different than the normal days of breathing, then that would be the cause and the reason to seek medical attention and be evaluated. I do want to highlight that this is the most common respiratory infection for children under the age of 1, But again, to expand that RSV isn't only a childhood illness, it can affect and does affect adults, particularly those with immunocompromised and underlying health conditions, such as lung or heart conditions, as well as the elderly. So it is something that we think about. Additionally, this tends to have seasonal spread and seasonal peaks. We usually see RSV starting around October, November, so right around the time we are in, and generally last all the way through the early spring time, such as March or April, with peaks usually in December or January time. And so with that, we are certainly heading into our months of risk and our months where those mitigation factors and recognizing those illness symptoms earlier and seeking medical attention earlier can be life-saving for our community and our individuals. I would like to highlight a little bit about the treatment of RSV. Generally, we treat symptomatic management and supportive care. There are certain medications that we can use in those who have immunocompromised that are FDA approved, but those are not routinely used in children and infants. Usually we provide support for the breathing, support for oxygenation, sometimes needing to go to mechanical ventilation or life support in severe cases. And then we can provide additional levels of support in the hospital, such as IV fluids, which would be through an IV line if people cannot maintain hydration status, and dehydration is certainly a risk when there's infection. We can also provide nutritional support and other symptomatic supports in the hospital. I also would like to highlight that infections in general, particularly of the respiratory tract, can cause co-infection, meaning more than one infection can be present at the same time. This can lead to more severe infection, and it can lead to primary or the leading cause of the infection, and secondary, meaning a second infection that has come and superimposed on top of that first infection to happen, causing more severe illness. Those co-infections can be things like COVID-19, influenza, any type of common colds that we would refer to, as well as RSV. So the bottom line being, if you have concerns, particularly with symptoms, high fevers, breathing problems, or breathing that is abnormal compared to normal breathing for that individual, please seek medical attention so that we can provide evaluation and immediate treatment. And I think that's mainly what I have as intro, and I'm happy to field any questions.
Thank you, Dr. Danko. We'll go ahead and open it up for questions for Dr. Danko or Kevin Dick or Nancy Dow, our Division Director of Epidemiology. So if you have any, please unmute and ask the question to the person that you want answering. Just want to make sure there's this is the last opportunity for any questions. Does anybody have any? Oh, we have one in the chat from it's asking about rates of monkeypox. Dr. Dow, do you have any data handy on monkeypox? Otherwise, we can. Here, hold on. All right, Alexander was on mute. If you don't have any, Dr. Dow, I can handle it.
So I do want to just comment that our monkeypox cases has been stable for the past 2 weeks. We've been at 21 cases so far, and the national trend that we're seeing right now that there hasn't been a severe uptick. In terms of rates, we can get you the numbers, but just overall, we've been having a pretty stable monkeypox case going forward.
Got a question for Kevin on the wastewater data. Is RSV being tracked through that data as well?
Yes, we are getting some data on other viruses that are being detected in the wastewater. The RSV was showing up as low concentrations, a low percentage of the total virus that was being detected in wastewater. Was predominantly COVID-19. I don't have the precise numbers off the top of my head, but we can share that data, Scott, after the briefing. I guess I would add to that, Scott. You know, the comparison of the levels of COVID-19 and RSV may not be a good indication of the relative risk of contracting it or the number of cases that are occurring, because the shedding rate could vary with those viruses and how they persist in the sewer. So we haven't had much experience, or UNR hasn't, in working with what do those levels in the sewer mean as far as number of cases occurring through our community. And we were able to get some feel for that through the COVID-19 pandemic, as we were having most of the cases that were lab results prior to the at-home test reported to the health district, so we could do some comparisons with that.
This is Siobhan from RGJ. Are you guys tracking illnesses in school still like you have with other illnesses? Like, do we know what's happening in the schools in terms of RSV, COVID,
Siobhan, I think that was you. We were having a hard time picking up the audio in your microphone. Could you mute and maybe unmute and try again? Looks like I'm still not picking up any sound. I can, if you want to call or text me or email me after, we can get that question answered for you. Are there any other questions we can answer? Okay, hearing none. Thank you all. Oh, wait, we have one. With holidays and family gatherings coming up and RSV increasing in other parts of the country, is there concern it could get much worse here and in the near future?
Maybe I can take a stab at that and then see if Dr. Danko has a follow-up. We are still early in the RSV season here, and we expect more cases typically in the December through March timeframe. And so the fact that we are seeing higher levels occurring now than we did last year, where we had more cases than normal, is a cause for concern of what we may see coming. And so, you know, we've seen in the news situations that have occurred in other areas of our country where our pediatric wards have been overwhelmed with RSV cases. And so it's important for people to take precautionary measures, as Dr. Danko discussed. Hand washing is still good, and cleaning high-touch surfaces and those types of things, but also to take advantage of the vaccinations that are available for flu and COVID-19. Those fall respiratory seasons are upon us as well, and if we can prevent people from getting severely ill with flu and COVID-19 and requiring hospitalization, that'll put us in a better place as far as dealing with RSV cases that may be coming. And I don't know if Dr. Danko, if you have anything to add.
Yeah, thank you so much. I agree 100% with everything that Kevin said. We are early in this season, so to speak. And as I said before, and we'll highlight again, because it is so important, that really our winter months, particularly November, December, January, February, it's cold. We tend to spend more time inside. Family gatherings, we have sometimes more people within a closer space together, spending time. All of those things increase the risk of spreading any and all types of these viruses and other infections by way of what we talked about. So all of those mitigation measures of washing hands, cleaning surfaces, spreading out a little bit so that we're not such in close proximity. If they're sneezing, trying to do that into a tissue, and then of course washing your hands after the tissue, or if you're helping to wipe the noses of children, making sure you wash your hands after you touch that tissue, because again, it's all of that leads to that cross-contamination and infection. So definitely we have an increased risk, as the question stated, with family gatherings and with holidays and with spending more time indoors and in close proximity with one another. Absolutely.
Was able to get Siobhan's question. She had asked, here it is. It could be for Dr. Dow or Kevin. She's curious about the tracking of illnesses of COVID-19 or RSV. Are they affecting our schools?
I think that's a good one for Dr. Dow.
So we are seeing outbreaks in COVID-19. For RSV, we're seeing this mostly in preschools or daycares and childcare facilities, and that is the majority of the population that is being affected by RSV.
Okay, thank you, Dr. All right, hearing none, I want to thank everybody, all of our media partners for joining us, and also Dr. Denko, Kevin, and Dr. Dow for answering those questions. I've recorded this, so we'll put this on covid19washoe.com. A few of you have asked for the recordings. I will get that to you as well. If anybody else needs it, feel free to send me an email. Otherwise, have a great day.
Thank you, everybody. Thanks for having me.